Welcome to Help Me Help Mama Live. I'm Cindy Orlachek Jones. Today I am joined by Tammy Smith with Absolute Care Management.
Yes.
We have a treat for you. In the past few days, we have been talking about the Journey Stop number 4, services at that point, and Journey Stop number 3. Today we're going to back up to Journey Stop number 2. When you as a caregiver are with your loved one typically 3 to 6 hours a day, and if you're getting toward the end of Journey Stop number 2, you know your loved one needs a little bit more help. So we brought in one of the professionals here to give you more details about in-home non-medical care so you can distinguish that from in-home medical care and other types of services provided in the community. So, Tammy, please tell our viewers what is in-home non-medical care.
In-home non-medical care is anything that is a non-medical nature. We're talking about helping with the housekeeping. We're helping with meal preparation. We're doing med reminders. We're helping with transportation to and from doctor's appointments. We're helping with anything that's not considered a medical service.
That's a lot.
It is a lot, and you know we're focused on keeping our loved ones in the home. And this is a big part of allowing our loved ones to remain in their home is to meet those needs that other agencies perhaps can't meet because they're more medically geared and they're paid for differently.
Okay, that brings up a couple of points. So let's talk about what specifically are the services that are provided under non-medical, a typical person.
Okay, we're going to do housekeeping services. We're going to help make sure that your house stays tidy, that your kitchen stays tidy, that your food in the refrigerator is not expired. We are going to help with personal care. We're going to help get you in and out of the bathtub safely. We're going to help you to dress. We're going to help with your grooming, making sure your hair's pretty, making sure your nails are done. We're going to help with meal preparation to make sure that you're getting those nutritious, balanced, healthy meals. We're going to help with med reminders so that we can make sure that mom gets those meds on time and that mom takes those meds every day. We're going to help with transportation to and from doctor's appointments, to and from the grocery store, to and from hair appointments every week, because we want mom to continue to remain as independent and close to the lifestyle that she's had all this time.
Approximately how many number of hours is a typical client?
We run anywhere from about 4 to 8 hours a day. A lot of what we do is relief for these family caregivers. Perhaps they're still working, perhaps they still have kids in the home. So we're going to be that respite or that relief person so that you can work or that you can do activities with your family.
Okay, so when do I as a caregiver ask for help?
I think when you become very overwhelmed, when you find that you're not perhaps meeting all of mom's needs, maybe even just as a relief for you, when you see that things are piling up and, you just feel like that it's time to get some help.
Okay, so let's say I have reached the point where I realize for me as a caregiver, I need some help. So I call you and say, Tammy, I need some help. What is the next step?
Someone is going to physically come into your home, sit down with you, sit down with mom, sit down with any other members of the family that want to be part of the care plan, and we're going to talk about the specific needs that you have.
Care plan.
Care plan.
What all does that encompass, and how long does that take?
It usually takes between 30 minutes and an hour, depending on how detailed, how many questions you have, how long you just, want to visit. Sometimes we want to do a safety assessment just to make sure that our caregivers are going to be safe when they're in the home. We may ask you to show us the bedroom. We may ask you to show us the bathroom. We may ask you just to give us a tour of the home so that we feel comfortable when our caregivers come into your home.
Okay. Okay, so you're going to cover things like medication and what mom has for breakfast and what she has for lunch and what she needs help with and how often.
Absolutely.
And that's going to be part of the care plan.
Absolutely.
Okay.
And another reason that we would come into the home is perhaps that family caregiver is not physically able to help get mom in and out of the bath. Maybe you just need help getting mom bathed 3 times a week. Maybe we just come in for a few hours, make sure mom's got a bath, that she can get in and out of the bath safely, and that she's dressed, and that may be all you need us for.
So what's the least amount of hours that you would go in and help?
I would say a 2-hour period. We have done just a med reminder where we pop in the morning and make sure that mom's had her meds and pop back out. So, we could do as little as an hour, but most of a personal care would be about 2 hours.
So that helps me to get Mama out of bed, showered, dressed, and breakfast.
Right, and ready to start her day.
And then maybe in the evening when they need help again, do the same thing.
Absolutely.
In reverse.
Absolutely.
Get her back in bed.
Absolutely. Get her dressed in her pajamas, make sure she's had those night meds, maybe get her a nighttime snack, and help her get back into the bed.
Okay. I found in caring for my mom and asking for help that the caregiver, it was very important that they had good training. And so tell me what are the requirements for your caregivers to come work for Absolute Care?
Our caregivers must at least have a personal care assistant certification. Now, we do teach those classes. Most agencies will teach those classes on site. We prefer that our our aides be CNAs, certified nursing assistants that have taken the CNA class. They are licensed by the state, but we will take a PCA. And those classes just ensure that those caregivers know what they're doing when they get into the home, that they know how to safely transfer mom, that they know how to safely get mom in and out of the bath, that they know, what are nutritious meals, what are balanced meals. They know signs and symptoms to look for, to throw the red flag up and say, I think something's wrong. I think we need to call 911. I think it's time to get the caregiver, the family caregiver back involved.
That's very important. Okay, my next question is going to be, how are these services paid for?
There are many payment sources. Many families find that they private pay, which is an hourly rate. Medicaid in Arkansas is available for seniors to help in the home, and that is an asset money program. VA will pay for some services in the home through different VA programs. Long-term care insurance can help pay for personal care in the home.
I have been telling people for years, get long-term care insurance. I mean, you have insurance on your house, and you're a lot less likely to use the insurance on your house than you are for long-term care.
Absolutely, and it doesn't even have to be, it could be something as simple as an injury. I slipped in the ice and I fell and now I broke my hip, and now, for only 6 weeks as I recover, I need some help. It doesn't even have to be with long-term care a long-term need. You might find that just a little accident, a bout of pneumonia, and a couple of days in the hospital will put you down.
Great. Okay, we talked a little bit about your case manager. Case manager is to get referrals to other providers and for equipment. You call that the referral for services. I thought this was wonderful because a couple of the companies that I used didn't have a case manager. And so I had to find all of these different service providers and all the medical equipment all by myself. And I thought, gray hair from that, So tell me about the case manager and what all they do.
As a Medicaid provider by the state of Arkansas, we are required to, we're not required to, but we have chosen to do targeted case management. And what that is that we have a case manager, either a social worker or a nurse, that will come into the home and evaluate your need for additional services. Do you need durable medical equipment? Do you need a hospital bed? Do you need a walker? They're going to do safety assessments in your home. Do you have the proper grab bars in your bathroom?
Girl, you are going so fast. Then the safety assessments is worth that,
Absolutely.
Oh, my God.
We're going to look at the rugs in your home. Are the rugs going to be slip-proof in your home? We're going to look at the way that you manage your medications. Are they in a manner that would be safe, both for mom and for the caregiver? We're going to look at even medical services. Is there perhaps a wound that's not healing that we need to refer out to home health? We're going to look
at those wounds, though, they can get ahead of you really quick.
We're going to look at organizations within our state, different support organizations that might be available to families, the Alzheimer's associations and such of the world that can help with education and different.
That's really important. I encourage caregivers to seek out support groups and to study if your loved one has a diagnosis, to study the disease, especially if it's something like Alzheimer's, so you know what to expect.
Correct, absolutely. And and you know what maybe is going to come next, or how to start making long-term plans. That's another reason to be very educated on your diagnosis.
Because you never know how long you're going to be a caregiver, and it can wear you out, like we talked about yesterday.
Yeah, absolutely it can. I mean, caregiver stress is a very real ailment, and it happens so often with our caregivers, and especially our family caregivers.
So tell me a little bit about that. What do you see? Because that's exactly what I talked about yesterday. As a caregiver, you need to take care of yourself. And see, someone else is saying
that.
this.
Well, it's a financial burden, number one, because sometimes our family caregivers end up taking time off work.
Right.
So they're losing hourly wage. They're cutting even down to part-time so that they can dedicate half a day, more time to taking care of mom. So that sometimes creates a financial burden on our families.
Which creates stress.
Which creates stress in our families, in our marriages. We don't think sometimes about the input that it might have on our marriages and on our other family members. It hurts the health sometimes of our caregivers because they're not getting enough sleep. They're not taking care of themselves. They're not going to their regular doctor's appointments to get their regular checkups because they're so focused on helping their loved one that they let their health suffer because of it.
You can't do that, because if you don't take care of yourself, you cannot take care of your loved one.
Absolutely. If and if you can't, and if you're not physically able to take care of your loved one, who's going to do that for you? You're not eating well because guess what? You're getting off work, you're grabbing a granola bar, and you're running right over to mom's house.
Yeah. Okay. If you've learned anything here today, or you've found some good information in this, please share this video with others. Tell us, Tammy, how if someone wants to contact you and get your services started, tell them what they need to do.
Through my agency, if you want to contact Absolute Care Management, I'm going to look at my card because I'm not as familiar with the 800 number as I am my number. I work out of the Conway office. Our toll-free number is 866-935-3730. And no matter where you live in the state of Arkansas, we can refer you to the appropriate site location that can help in the area that your loved one lives.
Thank you for joining us today, and we will see you tomorrow. That was great. That was a lot of information.